Thank you for joining us on a special edition of Inside the 1581. And as part of our We Care, We Vote initiative that the Oklahoma Hospital Association has launched, we have invited both candidates for the Republican runoff for governor to join us. And I'm delighted to have joining with me the Attorney General of the state of Oklahoma, Gentner Drummond, who is running for governor. Thank you, General, for joining us.
Rich, it's my absolute pleasure to be with you.
Well, this is exciting. And, we're going to just take about 15 minutes here, and we're going to share this with our members across the state.
Great.
So they'll have an opportunity to get to know the candidates in a very small snippet. Hopefully, they're engaged in watching what's going on. So let's just kick it off. Tell me about Gentner Drummond and why you're running for governor.
So it has been an objective for a long time. I had a grandfather that sat me down and said, I really want you to do two main things in your life. One, serve in the military, because none of us have, we're ranchers. And two, come back and serve the state. And so that's been a 48-year promise that is coming to fruition through this gubernatorial race. My background, I'm a public school product from Osage County, live on a cattle ranch, live on the same cattle ranch today. Wendy and I have raised our 6 children. They're all married. We have 7 grandchildren, 1 on the way. One of those children is a physician in the Tulsa market.
Awesome.
My brother's a physician in the Stillwater market. My niece is. My sister-in-law is a dermatologist. So we've got physicians all around us. After 8 years as a fighter pilot, I came back, practiced law, built companies. We have about 500 employees, about $35 million of annual payroll. So we're invested in Oklahoma. And, the time came in my life to run for Attorney General. It's been an absolute pleasure to do that. We've done some impactful things for public safety and the like, and now governor. And I will tell you, I don't say this because I'm sitting with you. The 5 objectives for me as governor, number 2 and 3 are right down your lane. 1 is education. We have to start with education. But healthcare and mental health, we are better than 48th and 46. And as one who lives in rural Oklahoma, I am acutely concerned with the policies of our state to protect our hospital systems. Hominy lost its hospital in 1991. That was the last year we had net migration into my community. If we don't change the trajectory, you and I would agree, our listeners would agree, we'll probably lose 27 to 30 of our very important rural hospitals across the state. And we can't do that. That would break the back of Oklahoma. And I recognize hospitals are more than just acute and chronic care. You are the engines of our state and of our communities. The economic benefit, the human power of the hospital system makes Oklahoma what it is, and we have to protect that.
Well, and I think that's important. I appreciate those comments because, keeping rural hospitals vibrant is critical to what we do. And one program in which we partner with the state and with the federal government on is a program we called SHOP. It's kind of wonky, but what it does is it allows hospitals and the state working collaboratively to draw down additional funding to lift the rates that we pay for Medicaid, which is well below the cost of care. And so there are going to be some cuts coming forward from Congress, about $6.7 billion on hospitals, about $1 billion on physicians and other providers. I guess the question for us is, can we look to the Drummond administration working with us on a mitigation strategy to really do what we can to ensure that those cuts don't really hurt?
Absolutely. We have to work together. You have not heard me talk about tearing down core services in the state of Oklahoma. I'm running against a gentleman who, through his desire to reduce income tax without a plan of backfilling it, is going to be devastating to the hospital network of Oklahoma. My objective is raising corporate revenues by the workforce development that comes through healthcare and mental health and education, partnering with our tribes to drive greater economic opportunity to Oklahoma, provides greater resources so that we can mitigate that risk. We cannot afford to lose another hospital in Oklahoma.
We couldn't agree more on that. When we look at some of the challenges that we have, workforce is one of those, and I think you just started to talk a little bit about workforce. Tell us a little bit about your vision for workforce. And it doesn't necessarily have to align with hospitals, but how do we grow and make sure we have appropriate workforce?
No, but we have to. You and I would agree, and the viewers would agree. We're short of certain key billets filled in the state of Oklahoma. As a matter of fact, the empirical data I look at, we're about 50,000 people short in pipe fitters, welders, electricians, plumbers, CDL drivers, nurse assistants, and hygienists. Just those 7 job descriptions alone were 50,000 short. Now, so much goes through the hospital system, and working in tandem with our career techs, I really think there's a path with our technical colleges, our career tech, to backfill and put a young person on a path. My own daughter-in-law began as basically a scribe in a doctor's office, and she's in PA school today. I couldn't be prouder of someone who over the last 7 years has worked her way through the system and decided exactly where she's most qualified and excited about being. And now in a couple of years, 3 years, we'll have a physician assistant in the family, and I'm so proud.
Right. And I have a daughter who's an LCSW too, working in mental health, which is kind of another question. You mentioned a little bit about mental health, and certainly that is an area in our state where we obviously need to make some more investments in. So how would the Drummond administration address how we can strengthen mental health in our state?
So I want to talk about healthcare and mental health at the same time. One, we need to hire not friends of the governor. We need to hire clinicians who are administrators in both the healthcare system and the mental health system. We have not had that. If we back the clock up 8 years, we had a robust and strong healthcare authority and mental health commission. And now we look at 8 years where the budget has been the same or lower, effectively reducing core services in those 2 areas, and we see the holes that have now developed. With regard to mental health, I mean, Wendy, my wife, her initiative as a first lady will be homelessness, mental health, and drug addiction. Those 3 in tandem have to be solved in Oklahoma. If it's her agenda, then it's going to be very important to me, because I recognize homelessness is a crisis. It's not a right. We need to work and make hard decisions, but drive that population segment of our state down through, mental health access, drug addiction rehabilitation, workforce ready, in tandem with our nonprofits. And there's a whole body of Oklahomans who care desperately about that. We hold ourselves out to be a Christian state, then we need to act like Christians. We need to act like believers, not to be exclusive of Judaism and Muslim faith, but we all need to work together to advance the common cause of the human plight. So that starts with leadership. It trickles down to funding. We have the CCHBCs that are critical deliverers of product. They've been on the governor's cutting block for years. We cannot do that. A Drummond administration will be a friend to healthcare and mental health, because I recognize my mother was a psychologist, for goodness sake.
Yeah.
So, I mean, I've seen this firsthand. And frankly, we're all damaged goods. We need to work together to improve our common lot.
When we think about healthcare, we often think about the big, huge, medical systems, and but the rural hospitals are unique, and so they're probably at greatest risk. So if you were to look at your state as the governor, is there anything that you would do differently to ensure that we are effectively making sure that our critical access hospitals, as an example, and our rural PPS hospitals are operating in an environment where they can thrive?
Right. We did that. I think that goes from a 340B awareness.
Great point. That's a good one.
We have
That's
to
something we should
protect
talk about. Yeah.
We have to protect that for the rural hospitals. The free market arguer might say that's passing a benefit on that's undeserved. That's not true, because hospitals serve everyone who walks in the door. So hospitals are underwriting a large transfer of services that are not reimbursed. 340B is one of those avenues through which we can seek reimbursement, but also the reimbursement rates need to be better. We need to revisit managed care. I know that the hospitals are working closely with the managed care organizations, but so many providers and rural hospitals cannot cash flow the 45 to 60-day delay that we're presently seeing. So there's many things that need to be fixed. The system's not broken. We have a remarkable system. We need to protect it and fund it.
I agree. And go back to 340B, just for our listeners, it is a program that's created by Congress, actually built off of the Veterans Administration, to ensure that critical access hospitals, our smallest hospitals, or hospitals that provide a disproportionate share of free care, have the ability to access medications at the lowest cost. And in Oklahoma, we passed a law that would prohibit discrimination, so the big pharma industry couldn't engage in efforts that would keep eligible hospitals and FQHCs from participating. We passed it in the legislature, overcame a governor's veto. We've been litigating it, and your office has been in the middle of that litigation.
We are in the middle of it. We're defending the hospital's right of access and the reimbursement. You mentioned something also, Big Pharma. When our insurance commissioner failed to enforce the pharmacy benefit management enforcement rules, the legislature transferred that to my agency. They witnessed what I did in Organized Crime Task Force. We formed that to break the back of organized crime. They said, well, let's give Drummond the enforcement of the pharmacy benefit manager laws. And it has been an eye-opener. We have got to have a watchdog that holds them accountable. They're rife with injuring our pharmacists, who, to so many communities, Hominy being one, that's our only source of health care, our pharmacists.
A lot of rural pharmacies.
Yes, we have to protect the rural pharmacists, which is part of the ecosystem of our healthcare system. And hospitals being the pinnacle, the providers, the pharmacists, we have to protect all.
We talked a little bit about workforce and the importance of investing in that. One of the challenges that we have, and certainly this messaging is for our team members and our caregivers to understand where the candidates are on issues that are important to them in the healthcare field. One is in violence against healthcare workers. We hear a lot about that. And hospitals are making a lot of moves to try and do everything they can to protect their team members. What are your thoughts, on strategies that we could deploy, or areas where you may have personally been impacted, your family member, or something that you've done in your public service?
Right. Hospitals find people at their worst, right? They come for the acute care typically. And we've seen, the extreme example of the gentleman who came in and murdered a physician in Tulsa.
Yeah.
Shortly after you took your position, I can remember you bringing me and briefing me on things that are important to the hospital association. One of them was violence against caregivers.
Yeah.
I have briefed all 27 district attorneys on that issue, and they are instructed to protect and enforce our healthcare workers. And if they will not, then I, as the Attorney General, have plenary authority in all 77 counties that will go in and do that. So anytime a hospital or a care provider has any sort of threat or violence, it needs to be reported to your district attorney, who will prosecute that individual and send a deterrent message across the state that that is not tolerable.
And I think that's incredibly important, that caregivers know that they have, agencies and leaders that are going to have their back on this, because it's really hard as the hospitals to protect them in every corner,
Right.
knowing that there's a law and then there's an action behind it, and supporting them is important.
Right, and just seeing the role of the healthcare provider, you are at your most vulnerable, focusing on the need of the patient, not aware necessarily of that person's violent nature or their reactiveness, and a lot of times healthcare, mental health issues are a factor in this whole process. So my heart goes out to the healthcare providers. I have their back. I will always protect them, not just as the Attorney General, but as governor.
We've been very blessed as an association to, look for every opportunity to collaborate with government. And I think there's opportunities from our hospitals wanting to collaborate more. In a Drummond administration, how would you view collaboration working with, organizations, either the hospital association, individual hospitals, FQHCs, to advance, your vision for healthcare in our state? How would you approach, partnering?
Certainly. I'm not a dumb guy, but I'm not a subject matter expert of all areas. And what a Drummond administration will be different from a Stitt administration is that hospitals and hospitalists will be at the table. We need all stakeholders in the healthcare arena adding input so that we can be most prepared from a policymaking perspective to do the right thing and have experts help us anticipate the unintended consequences. We see that rife throughout the state of Oklahoma right now, where we have a current administration that is simply not aware and is driven more by the dollar. How can we reduce the deployment of dollars in the state of Oklahoma? We have to elevate the deployment of dollars. It is too critical.
General Drummond, thank you so much for joining us in this special edition of Inside the 1581. Please take the time to get to know the candidates, know what the issues are, and know when it's time to vote, because the primary or the runoff is coming up on, correct me folks, it's on August 25th, right?
Yes,
All
August
right, August 25th. So make sure you get out there and vote. Thank you for joining us.
Thank you,
Appreciate
Rich.
it. Thanks.